Oh, sure. Okay, good. Okay, welcome everybody to our first session of our data management series. We are so happy to have all of you here. And let's see, I really appreciate everybody joining us today. Thank you so much for using the chat box to register or not register, but just tell us that you're here. And if you just put your name, title, organization, and your email address in the chat box, we'd greatly appreciate it. And let's see, what we're going to do today is first I'd like to welcome our esteemed guests from the CDC who will be conducting the training today, and also all of our wonderful co-workers from the Rocky Mountain Tribal Leadership Council and the Rocky Mountain Tribal Epidemiological Center. Thank you so much for joining us as well. And to our great partners out there in our tribal lands, we are so appreciative to have all of these agencies represented today in this training. Thank you so much for joining us. And just one second, I just have to pull something up here. Rachel's going to go ahead and share her screen, and it'll go through like the very first couple of slides that you've seen already on the looping video, but it kind of gives us an idea of like all the expectations for the meeting today. This is my contact information, so if anybody would like to get a hold of me about any other training needs that you may need, please let me know, and we will be able to facilitate according to what your agency is going through. Our presenter today is Dr. Rachel M. Burke. She's an epidemiologist with the CDC's COVID-19 response, and she helps support the tribal support section. And today's management series, our data management series, is going to first talk about the RShiny app that is designed by the CDC. We're very excited to see how this all functions. And Rachel, do you want to go ahead and introduce a little bit about yourself as well?
Okay.
There you go. There you are.
Sorry about that. I just wanted to say thank you for the opportunity to be here today. I'm really excited to speak with everybody about this app. I'm hoping for a very interactive session. And yeah, just please feel free to jump in at any time. Sorry about the technical difficulties.
Totally okay, totally okay. We love to begin each of our sessions with, I just want to remind everybody here that we're going to be recording this session, and if you do not want to be recorded, we can edit that out, but I just want to let everybody know that by participating in this session today that you will be recorded and it will be shared either on our YouTube channel or through our training website. Once that gets up, we will have this ability to share this with other people at a later date. So your identity will be part of this video. If you're asking questions, it's best to use the raise hand icon, but you can also use the chat box to input any questions. And then we would love for you to please mute your phone or your speaker when not speaking, so that we can all hear. But there's going to be times when Rachel's going to ask for questions. Go ahead and unmute or use the chat box to ask your questions. And then the last part here is after today, if we have any additional resources, they'll be uploaded into that Google Drive and sent out via email as well. And of course, this is not the only session, so we'll have another session next Thursday as well. We like to start each meeting with a prayer. This is where we start with in a good way, recognizing that we're brought here together to support each other, to learn new things so that we can go out and spread the love to everybody in our communities. So here we go with our smudging prayer. Creator, bless me this day to have good thoughts, to see good things in a person, to hear good things from a person, to talk good to a person so that I can walk with others in a good way. Thank you, Creator. Ha-ho. And thank you, everybody, for joining us today. And Rachel, go ahead and take it away.
Okay, thank you very much. Yes, again, thank you, everybody. It's nice to meet all of you. Let's see, moving forward. Okay, so what I wanted to do first is just give a little bit of background on, why we developed this app and how it came about. As I'm sure you are all very intimately aware, we've noticed over the course of the response that tribal nations and tribal serving health facilities face a lot of challenges with COVID-19 data and reporting. There are often multiple jurisdictions and entities involved. You have the county, tribal health departments, different health facilities, and of course, in this time of COVID, everybody is facing time and staffing constraints. People are doing 5 different jobs in addition to their regular full-time job, and that just makes things difficult. Plus, in many health facilities, people are using medical software that's designed for patient management, and it's not really designed for surveillance. So it can be hard to get that data out and get it in a format that's useful. There's also all kinds of different indicators that people may be using, and I know that many facilities and many organizations have a number of different reporting requirements to different entities. And so what often happens and what we hear very often is that people feel like they have suboptimal situational awareness. They're kind of trying to cobble together data from a number of different sources, but they don't have the time, or it's not the right kind of data, or they don't have the staff to be able to really put that together into something that is useful for making decisions. So that is why we developed this app, and we call it the COVID Reporter. And this is really designed to facilitate data analysis and data sharing. So what it does is it takes information starting from your patient information database that you are already keeping. So for instance, then we work with you to extract that data to your computer locally. It gets read into this on-site application, so it's not leaving your computer, it's not going to an outside server, it's just staying there locally. That is used to develop this customizable report, and then that can be shared with different stakeholders to provide input into tribal decision making. So what are the main points of this app? We wanted to design it to help people get more out of their data. So this is a point-and-click app. There's no statistical experience needed. As you'll see from the interface, it's really easy to open it up. You just point and click and select based on your options, and you don't need to fuss around with any statistical code or formulas or anything like that. It uses available data from medical records, so you don't need to keep a separate line list or do some complicated copying and pasting. And it's also possible that if you have some sort of other standardized database, like for instance, a case investigation database that you're keeping, we could also modify this app to use those data as well. And then lastly, this app is running locally on your computer, so you don't have to worry about transferring out PII or PHI or sharing it with unauthorized parties. So it stays there, it generates a report that doesn't have any metadata associated with it, so that report can be safely shared. And during that report, nobody is, transferring out data. So where have we implemented this app? Well, we have completed implementations in the Hopi Healthcare Center. Since July 2020, they've been using a version of this app. It's also been implemented in the Reno Sparks and San Carlos Apache a bit more recently. And then we have a few other planned implementations, state tribal liaison, a couple of different tribal health facilities, and then we're just, getting more interest and trying to keep up and get this out there to really help people. So what I wanted to do now is do a demonstration, and then hopefully everybody who is interested can follow along with the materials that were provided. So we'll go slow, kind of step by step, and try to kind of keep everybody on the same step. And if there are any questions, please ask them, as we go along. And, of course, it's optional. If you prefer not to follow along live, then we will still have these slides available for your review in case you want to take a look at it later on.
So Rachel, we have a question in the chat. It says, is there a plan to connect with urban Indian health centers to this app?
So we would like to make this app more broadly available, and we deploy this app really on request of specific tribes or specific tribal health centers. So if there are different urban Indian health centers that would be interested in this app, we would be very happy to work with them on it. So if there's anybody that you think might be a good candidate, please feel free to connect them with us and we can follow up. Okay. Any other questions?
Not as of yet. They just said, Madison said, thank you, thank you.
Okay. Okay, so here, sorry, I know this is a bit small, but I'm going to be doing a couple of different things at a time. So firstly, I want to check that everybody has the app, quote unquote, installed. And really, this app, there's no installation per se. It's really just unzipping all the files to a single folder on the C drive or a USB drive. And you don't want to save to your network drive because then it won't work. And then everything should really stay in this structure. So for you, our Mac user, Mr. Martin, you're actually going to save it on your desktop. So it's a little different for you, but everyone else should have it saved on their C drive or on a USB drive. So I want to check I'm going to give a couple moments and then I'm going to look at the hands raised to see if there's anybody who wants to follow along that just isn't quite there yet with saving all these files.
Sorry, Dr. Burke. I could not hear you. You were cutting out. I think my connectivity is just in and out. But you said something to me about the Mac user.
Yes,
Martin.
Thanks, Mr. Martin. So you are going to unzip the file, the folder. You're going to unzip it to your desktop. So everybody else is going to unzip it to their C drive, but you will have it on your desktop.
Okay, great. Thank you.
Sure, thank you. Okay. So the next step is to launch it. So you're going to go into your folder, and I think, let me double check. I think I'm sharing my I'm going to share again, sharing my whole desktop. So you should see my folder here called Test App. So mine is a lot busier than yours because I'm always working on these different development versions. But the way we start it is we just double click here on the run SU report _bat. And Mr. Martin, you're actually going to click the one that's called something like test SU report .command. So we're going to double click that. Sorry, go ahead. And then it should open up this screen here in a browser. So I'm going to pause here and then ask anybody who wants to follow along who is not at this screen could you please raise your hand? Okay, I don't see any hands raised, so I'm going to guess that everybody has made it to the screen. So now what we're going to do is we're going to input the files. And so these are files that were created. They are simulated data, so they're not real patient data. They're just fake for the sake of this app. So we're going to go into our folder called dummy data that's in that app. And for this overall labs file, you're going to select this one called sample lab RMTLC training. And just click open. So that's going to upload into here. For vaccines given, we're going to select this one called sample vaccine. And then for this one called vaccines denominator, we're going to select this sample denominator RMTLC. Okay, so everybody's screen should pretty much look like this. Okay, I see there's something. Okay. And then what you'll see here is if you click inside this text indicating positive result, these options are auto-generated from this lab file. So for instance, if you have a lab file that says, maybe it says SARS-CoV-2 positive, that would show up here. But this lab file has COVID-19 positive and detected as our positive results. And then for our negative results, it shows up as COVID-19 negative and not detected. And so here we can just input the name of the health facility or entity generating this report. So I'm just going to type in my facility here. And so now that I have all my options set up, I'm going to go to the next one. And this allows me to select the desired reporting level. So I can select either I can generate a report for the full patient population in the database, or I can generate a report just for a specific tribe in the database. So this is, I'm going to do it for test tribe. So I'm going to select test tribe, and if I wanted, I could even also select this other tribe here. But I'm just going to do test tribe, and then I'm going to click again out here, and that allows me to click this button. And so what it's doing now is that these data are getting run through this analysis code, and it's building a report that's going to show up in a couple minutes. And so this window, as it says here, this window will disappear when the report is ready. So it's just running that code, and it's all happening locally on your computer, so nothing is getting kind of sent out or leaving. It's just there. And what happens is that it gets saved to kind of a temporary location on your computer. And then here we are, it allows us to view that. So we can just click to open it up. And it looks like this. So now I'm going to go back for a minute and we can set the options again for this vaccination report. So I'm going to do the same thing over here. I'm going to select here, and then I'm going to create this report. I'm just going to check to see if we have any questions or difficulties from anybody. Okay, I don't hear anything. But I do see, so for this vaccination report, what this module does is it creates this Word document report.
Hold on just a second, Miss Rachel.
Oh, go ahead, yeah.
We have one group who is having a hard time getting the app to launch.
Okay.
And another person who's having a hard time getting the website to load.
Website to load. Okay. Let's see. I wonder if we can do a little bit of troubleshooting. Would any of those of you who are having issues, would you be comfortable sharing your screen and then we can take a look? Because you have this issue, there might be others who might have the same.
Let's start with Erin. Erin, you want to go ahead and share your screen?
Certainly I can, but you won't see anything because nothing happens. I'm looking for where it can share.
And while Erin is looking for that, we have a question. It says, do you have to have Word in order to view the report?
Yes, I think you do because it's a Word file. There could be a way of saving it possibly with a,
Like a rich text format?
yeah, you could save it kind of to your desktop and then open it using your text, like a rich text editor.
Okay, and then Sundak also says you could also use Google Drive to view the Word document. So if you download it, even though you don't have Word, and then upload it into Google, then you'd be able to view it as a Google Doc as well.
Okay, Erin, I'm seeing your screen, so it's not happening.
Do you see my files?
Yeah, I do.
So when I click on the .bat file, like a brief window pops up and it disappears immediately.
Okay.
I don't know what's happening. It's not up long enough.
What is your default internet browser?
It's Chrome.
Okay. Sometimes it doesn't work with Chrome as a default browser on a PC. You could try changing your default browser to IE or Edge if you have those, or maybe Firefox, and see if that...
Have Edge. So.
And that would help Desiree too. Desiree, if you want to change your browser preferences to something other than Chrome.
Yeah, I don't know why it doesn't like to work with Chrome. It should be, it shouldn't change, but it's kind of, fussy sometimes.
So Desiree is using Edge also and having a hard time. And then Sunduk says some desktops ask permission to run a batch file. So that little window that popped up might be the permission box.
Okay.
And
yeah.
it might be running in the background.
Yeah, because what should happen is that you should see like a command terminal come up. But if you don't have permissions to do that, then we might have to kind of add some permissions into this batch file.
Yes, it still doesn't work even though I switched to the default browser Edge.
Okay. Let me think if I can kind of troubleshoot it in some other way. Let me look at it on mine. Hang on. Let's see.
Excellent. Desiree says that they got theirs up.
Oh, great. Okay. Erin, can we look at if you right-click on that batch file, and can we look at the properties, please? All the way at the bottom.
Okay.
We're not seeing that. So.
Oh, okay. Can you see?
Not not yet. Okay. Let's see. Can you scroll over to security, please? All right. This looks pretty much the same as mine, so I don't totally know why yours isn't working. Let's see.
Erin, are you on a CDC Foundation computer?
No, I'm on my home computer, and I should
Okay.
be an administrator on my own computer.
Yeah, that was the only thing I could think of.
Right.
And then Sundaka's asking if you have two screens. A pop-up window might be showing up behind some other app.
Yes. No, I do have two screens, but I've closed everything out except for what we're looking at. There's no other windows.
Okay.
It's okay. My IT guy is coming, also known as my husband.
Okay. So
Should
yeah.
Should we go on?
Yeah, let's move on. And then I have some other things that we could possibly try later on, Erin. So I can get back to you on that. Okay. How's everybody else doing? Did we have any other problems that were happening?
It doesn't look like it. So yeah, go ahead.
Okay, so I'm going to go back to these reports. Let me see here. Okay, I'm going to share my desktop. Go back here. Okay, so we have in this vaccination report, we have our ability to see the report, and then what it also does that can be built in is that it can build this kind of, more nicely formatted data set. So, sometimes when you take something out of a medical records, it's in a format that's not very user friendly, right? So what we can do is we can kind of use the app to reorganize all this data. So for each person here, we can see, when was their first dose, when was their second dose, and then some demographic information about them. So this is the other thing that can be built in. Okay. All right. So what I wanted to do now, so we've gone through, this information about how to set things up. So I wanted to go through the actual report contents so that we could talk about, why this might be useful and take questions about, what other things would you guys want or would be useful for your applications and how you want to use your data. So I'm going to start out with the surveillance report. So if you are looking at the that first page of that COVID surveillance report, what you'll see is this kind of executive summary page. So we put this together to really give just a very quick overview of, what's going on right now. So what's happening in the past 7 days, which is really useful to kind of see, okay, what's happening now, but important to keep in mind that if you're having a really long lag in getting test results, this information can be misleading because it can be incomplete. For that reason, we also show for the past 14 days what is the trend in the number of new cases, what is the trend in the percent positivity, and then where are the most new cases in terms of age groups. And then we also here have the simplified epi curve that shows, the cases over time. And this is based on the collection date for this version of the app, which is created using eye care panels. And then again, it has this very recent data in gray just due to the possible incompleteness if we have some recent tests that are still pending. So this is what we thought of as kind of a summary, but again, this is something that if you wanted to work with us to customize this report for your use, this is of course something that we would want to make sure that is useful for you. Similarly, the next page really just has kind of overview numbers, and this is a text summary that could be kind of a, again, it's an overview, but it's in a little bit more detail, it has a little bit more information, and this is where you would kind of copy and paste from the report below. So for instance, you would copy and paste, what is the trend in the percent positivity, and then what is the numbers in the percent positivity. And then this really allows you to kind of customize your, if you have gating criteria in place, how are these data relating to that gating criteria? And then if you have specific recommendations, this also allows you to, input them here. So this is really just a template. Okay, so the third page that we put in place is, and I know this is a bit text heavy, but it has kind of a first section here that shows the summary statistics for your entire data set. So in this version, it's for an entire service unit. And it shows a total number of tests that have been ordered. And then it deduplicates tests that are occurring within a 3-day time period to account for the fact that you might have somebody come in, they get a rapid antigen test, it's negative, but you want to send out for a confirmatory PCR test. And so those two tests would get grouped into a single test for this number. Sorry, this is the number for individuals. This is the number for the grouped tests. And then finally, it kind of pulls out the total number of positive tests and the total number of unique individuals. And then it does the same thing, but for whatever tribe that you have specifically selected. Okay, the next section is about changes in newly identified cases. So here in the text, it pulls out that trend based on the past 14 days. So if it's low, if it's increasing, if it's decreasing, that'll show up here. And then it'll also pull out any pending test results. And then it'll show, again, an epi curve, but this one is a bit more, has a bit more information in it because it also has these kind of averaged and smooth results here in the red. And that's just to kind of smooth out this trend over time, especially if maybe you're doing tests, fewer tests on the weekend, for example. These red dots and lines would help to kind of smooth out that trend. And again, we see the recent in gray just as a visual reminder to anybody looking that, these ones are still to be interpreted with caution. The next part is about percent positivity, and it does as well very similar. It pulls out the trend in percent positivity over the past 14 days, and then it pulls out some numbers about the average positivity, number of tests, and so on. So this graph here shows the daily tests in these bars, and then it shows, and this is the corresponding y-axis, and then it shows the percent positivity in these dark blue lines and dots that are kind of smoothed out. And that is corresponding to this right-hand y-axis. So we can see here for this simulated data, we have some kind of increases it kind of bumps over time. And then in these past 14 days, we have the beginning indication of an uptick here. Okay, so that's kind of what this part does. The next part just shows percent positivity by month, which can be useful if you want to look at kind of historical testing trends and results trends. So this is good to kind of keep in mind with your previous knowledge of, were we testing a lot of people at that time or not so many people at that time? And then our next section is cases by community. So we can see here the previous cumulative cases, the new cases in the past 14 days, and the current cumulative cases. And this can be useful to see if there are specific communities where you see a large number of cases very recently. Those might be ones to prioritize for outreach activities. So of course you may have some sort of alert system like this in place already, but this is a way to use your data to kind of inform those activities, maybe in an easier way of analysis. And then here is just a figure of those cumulative cases by community. The next section shows age trends. So here we see the median age of the cases, the minimum and the maximum, and this age distribution overall. So again, this is made-up data, but even in this made-up data, we have a lot of cases in this older age group. And then the next shows the age distribution of cases by month. And I know you guys have probably heard about how this tends to change over time, and so sometimes we see, a lot of cases in older age groups, and sometimes it seems to tick up in the younger age groups, and so this could be a way of helping you to keep track of that in your own communities and see if there are maybe certain age groups that need special messaging or special interventions. Okay, so that's the surveillance report. So that's this file, here that we generated on that first section, that first tab. So I'm going to pause for a minute in case there are any other questions about this report specifically, or how it could be changed, or how it could be used. Okay, so let's move on to the next section. Okay, so this is the vaccine report, and similarly, it starts out with an executive summary, so it shows total and total number of 1+ doses, total with 2 doses, full coverage, and then the progress in the past 7 days. And again, this vaccine report was really built for a specific situation in mind, so would probably want to customize based on what's going on in your community. But this is the type of information that has generally been felt to be useful. So we have here also what's the timeliness of the second dose. And then just for information, how many people have we reached that had a previous COVID-19 infection? And then we can also see the vaccination coverage by risk category. So for instance, maybe you're distributing your vaccines according to these different risk categories. This is our oldest age group, second older age group, high-risk adults, adults without comorbidities, and then our pediatric population here. So this shows the coverage by risk category of, how many of these people are we reaching with 2 doses versus just 1, And then if we look at that in a percent format, what percent of these groups are we reaching with 2 doses versus 1 versus none yet? This next is very similar to the surveillance report summary. So again, it just shows, when are our data from, what are the dates, what's the denominator. So here, the denominator is all the patients who had at least one visit to this particular service unit in the past 3 years and are still living at the time the data were downloaded. So that's our full vaccine eligible population. And then it just kind of specifies, which population, which tribe is included if you decide to subset. This report also shows the vaccination over time. So we have our blue bars are the vaccinations given each day, and then the red lines is the total number of vaccinations given by the date. So as we expect to see, our cumulative vaccinations are growing over time. And that trend should continue. The rest of this report shows vaccination by group. So here it presents it by risk category. What's the size of that population? What percent has at least 1 dose? What percent has 2 doses? Similar thing by age group here. Similar by sex and by comorbidities. And these comorbidities here are classified based on the iCare Active diagnostic tag field. So those of you who are RPMS iCare users are going to be familiar with that, but that's just an indicator that shows various comorbidities that a person might have active in their medical file. And then here it just shows again coverage by previous infection as well as by community of residents. So again, this might be important to figure out if there are certain communities that need to be better targeted for vaccines. Here is also a potential element of this report, which shows individuals who have a positive test after being fully vaccinated. And so that's counting as people who have received a full course of vaccination and passed at least 14 days after their last dose, because that's when you're considered fully vaccinated. And so these persons, we do know that there are some variants that have been identified where the vaccines may be less effective. So if we see people popping up as positive after they are fully infected, those are people that you might want to consider for further investigation and possible, other interventions. So it is very important to keep in mind that no vaccine is 100% effective in preventing all infections in all persons. So we expect to see some infections even in vaccinated individuals, especially as coverage goes up and community incidence goes down. But if you see some, kind of recurring patterns like this, that might be a cause for further investigation.
Rachel, we have a question in the chat. It says, can the Johnson & Johnson data be displayed, or is it included in the 1-dose data?
Yeah, perfect question. So that can be displayed, and that would need to be, so pretty much we would just need to rework the analysis code here a bit so that it takes into account the type of vaccine so that it can say, okay, who do we have that's partially vaccinated, which would be 1 dose of Pfizer or Moderna, and who do we have that's fully vaccinated, which would be either 2 doses of Pfizer or Moderna or 1 dose of Janssen. Other questions?
Not so far.
Okay. Okay, so you might want to know, how can you apply this to your own data? So for those of you who are based at health centers that are using RPMS, what you can do is set up an eye care panel. And that eye care panel, these are the specific instructions, and they are also provided to you in a Word document. But what you would do is you would set up that eye care panel, and including the lab tests that are used at your facility for diagnosis of COVID-19. So that's going to be your different kinds of PCR. If you send it out, if you have a Cepheid, if you have an Abbott, it's ID Now. That's going to go in there, and also your antigen tests if you're using that as well. It's not going to include, your antibody screening tests that you might be doing. And then what you'll do is you'll open that panel in iCare. You'll select the lab tests over here in definition details, and then you will export that to Excel. And this is what is going to become your labs file. So if you open up the that dummy file, it's going to look, something like this, where it has the different information here, different variables, and that is what you would be feeding into this app. And then, more information will be forthcoming with how to generate the necessary information to run the vaccine panel. But as discussed, that code will need to be modified just to be based on, what is actually going on in your particular area in terms of how you are considering different groups for prioritization, if you are doing so, and which vaccines are in use. Okay, so what about if you are not using RPMS? What if you have a different system, either for medical records or for case investigation? What would you do? Well, you would contact us here, and we would help you to customize this app to meet your needs. And so what does that look like? Well, we kind of go through a process of figuring out who's going to be the end user, who's going to be the right point of contact, make sure we get this report template the way you want it. We'll then help you figure out how to get that information out of your medical records or other database. What does it look like? We'll modify that code and troubleshoot the application. And we can use for that some simulated or some test data so that you don't have to share your patient data. And then we'll, once we modify that, we can train the users, transfer the files, and then do some refining and troubleshooting as necessary. So we are providing ad hoc support for some of these previous deployments. It's been pretty smooth so far, and we are doing our best to build this out so that it can grow with you. So it's really our hope that for those who implement this app, they can customize these Word documents, and then you can share it with your partners as a Word document or as a PDF, can copy out those graphics and tables, and we hope that it really helps you look at changes over time or differences by different community. All right, so I'm going to stop here for any more questions or discussion.
Well, Erin got hers to run. She did it.
Oh, great. Oh, good. I'm glad to hear that.
So folks, do you have any questions so far that you would like to go over? There's a question from Vivian. Is there a way to merge the curative testing data into the app?
So I'm not familiar with curative. Can you provide a little more information?
So I believe that curative is a brand of testing. Yeah, and it's a lab. Curative is our outside testing lab, Arlita is telling us, and she can download a CFV file, a comma separated value file from Curative, and would be able to upload it. Would this app take the CSV file?
Yes, so this app can take any CSV file. We would need to customize the code for that because it wouldn't necessarily have the same columns named the same way. So we would need to kind of take a look at those columns and understand that data structure. But we could modify it so this app could take that in and analyze it for you.
So in other words, we just have to make sure that the fields are named the same so that it would work.
Pretty much, yeah.
Okay.
And then we'd also want to understand if you also have, other data sources that you use. Yes, the Wyoming RedCap.
Yep.
Yeah. Yeah, so what we would want to do is to just understand those two data sources. And actually, we are working with Wyoming right now to try to get this working with that RedCap data structure. So once we do that, if we also were able to, get the column names and understand how that curative data are coming in, we could build that in as well so that, for instance, instead of having this, overall labs and vaccines given, you would have one upload for your RedCap export and then one upload for your curative export. And then it would do, very similar things, probably slightly different because I know there's a lot of other information in that case investigation database, but it would be a similar interface. Yeah, and it would take, as long as we know what are your data sources and what do they look like, we can customize it to take those in. Yeah, and as Sundek is saying, if there's medical records information that would be a consolidated source of some of that information, that would also be another option for running this app. It just depends on what you have access to in terms of data and how easy it is for you to download some of these various data sources.
One of the questions that came through chat was, would this video be made available? And yes, it will be. So we are recording right now so that we can post it, and then you can refresh your knowledge as you go through. So some of you might be working on the app as we're going along, and some people may, need to have some time to be able to figure it out on their own. And so we'll make that video available to you after this session today so that you can so that you can review the information on your own time. And we had a question that says, will the slides be available? And yes, the slides will be available as well.
Here we go. So more memes. I have here a dog and a cat, in case some of you are cat people. But just, really wanted to thank everybody for your time and attention and your participation and engagement. Really appreciate the opportunity to speak with everybody today. And we're certainly here to answer any more questions or to help you guys customize this app for your particular needs. So, yeah, thank you very much. Of course, couldn't have done it with many other collaborators at CDC as well as elsewhere. And that's it from me. So back to you, Jennifer.
We would like to thank all of you for attending today. Now, I understand that for some of you, you may have been going along with us while you were on your computer, and some of you might have just been observing the training to see what it's all about before starting the app. So what we would love for you to do is, if this is something that is like you're gung-ho about it and you want to start using it, go ahead and start going through the instructions again on how to download the app and start playing with some data. And if you have any questions or concerns, a little bit of troubleshooting, things like that, why don't you shoot us an email, and we'd be able to maybe get together with you individually or on one-on-one to be able to troubleshoot and explore the app. We would love for you to join us again on next week on April 15th, 9 o'clock, and I'll get more information out about that to you by the end of this week or Monday next week. And we'll be going over some more tools and some more really cool things that you can do with data and help visualize it with the Kobo app as well as Google. And we want to thank the CDC for joining us today and all of your support in this mission. I'm so excited about all the things that we can do with the applications that you've shared with us. Thank you so much.